And, this CRISPR technology, you're licensed it from Beam, is that correct?
Yeah, so the base editing technology we licensed from Beam Therapeutics, and then over the last 4 years, we've taken that technology, combined it with guide RNA, as well as the lipid nanoparticle technology to make a drug product, Verve 101, that we have just dosed a first patient with.
And the lipid nanoparticles allow you to get exclusively into the liver.
That's right. It's a liver-directed therapy. When you infuse in lipid nanoparticles into the bloodstream, almost all of it goes to the liver and is taken up by liver cells. The contents of the lipid nanoparticle, in our case, there's the mRNA for the editor and the guide RNA that tells the editor where to go to make the spelling change, are released into the cytoplasm once the contents are in the hepatocyte. Once released into the cytoplasm, the mRNA is translated into adenine base editor protein. That protein binds to the guide. That complex makes its way into the nucleus, and believe it or not, Mike, scans chromosome by chromosome, all the chromosomes, all 3 billion base pairs, until it finds the spot that we've told it to go to, which is in the PCSK9 gene. And then once it sits there, it'll make that A to G spelling change in the gene sequence to turn off the gene.
So you've done your first demand. What's next, Sig?
This study will involve about 40 patients with heterozygous FH, and we're looking to have clinical data, at least interim clinical data, in 2023. This will set the stage for understanding the safety and efficacy of this medicine.
So you'll be looking at LDL lowering, persistence of LDL lowering, and what kind of safety signals will you be looking at?
Well, we'll also be looking at PCSK9 lowering in the blood as well, which is a really robust biomarker. On the safety side, we will be monitoring for infusion reactions, which is one of the most common side effects with all lipid nanoparticles, and for any other effects that it may have, lipid nanoparticles might have on the liver or other organs.
I like to analogize what we're trying to do, Mike, to actually what you do every day in clinical practice in terms of an interventional procedure. So this is, to me, less like a drug and more like a procedure, a one-time treatment to permanently lower LDL cholesterol. And I think that this has the potential to really change the way we treat cardiovascular disease going forward.
I think this is absolutely revolutionary. I'm glad you're calling it an interventional drug. As an interventional cardiologist, I'll do the infusion in an infusion clinic.
Absolutely.
And the other big thing, Sek, I think the current PCSK9 inhibitors failed largely because of economic reasons. I mean, look, the bottom line, will you make this accessible to the public? What's the cost of it?
Absolutely. Our goal here, when people think about these kind of medicines, gene editing, they're thinking millions of dollars a dose. Right. That is not going to be us, because we want to reach millions of patients. So our primary goal here, first, is to document the efficacy and safety, and second, to be able to price this in a way that's accessible, not just to people in the US, but around the world. And we think we can do that. The reason is, Mike, is that our drug looks very much like a COVID vaccine. It's basically mRNA coated in a lipid nanoparticle. And we now know that that kind of drug can be made very cost effectively.
So, the usual number that's out there is about $3,000 a year for, say, Crestor. Can you come in at that number one? And number two, are you going to do what Clyde Meanwhile did, which is to go to countries, to the Ministry of Health and say, look, pay us for, the dosing of the drug for your entire population, rather than selling the drug on an individual basis to insurance companies. I see you smiling, Andrew. So what's going to be the plan there, you two?
I think that we have thought about the population health model, and that's something to kind of entertain as we go forward over the next few years as we develop this medicine. I think on the pricing side, I think the way to think about our medicine is replacement costs of existing therapies for some number of years that we're going to get credit for durability. And that's kind of the simplest way to think about how to price a one and done medicine.
Yeah, I think that's a good point. And the advantage of this over the currently available strategies is you don't have to keep coming back every 2 weeks or even
exactly. The average person with a heart attack, the average age is 65. I imagine a future, Mike, where that person comes in with a heart attack, they get their stent from you, and they get Verve 101, a one-time infusion that'll take care of their LDL for the rest of their life.
Yeah, that's great. Well, an interventional cardiologist like me, we'd want to infuse the drug right down the coronary arteries, but we won't do that because it works. So at least we know that. All right, you two, thanks for joining us, and thanks to all of you for joining us here at Snackable Health.